Hello, my name is Gaspar Del Rio-Pertuz, current first year internal medicine resident at Texas Tech University Health Sciences Center at Lubbock, Texas. Thank you very much for your interest in this clinical vignette with the title of Spontaneous Coronary Artery Dissection After Multiple VSTs, a new manifestation of Cuny syndrome. He reported a case of a 32-year-old man who presented with acute anterior wall myocardial infarction immediately after honey bee stings, that is also known as Cuny syndrome. The Cuny syndrome is defined as the occurrence of acute coronary syndrome following an anaphylactic or anaphylactory reaction. Bee stings as the trigger of Cuny syndrome have rarely been reported in the literature. So our case is a case of a 30-year-old male who presented to the emergency department complaining of chest pain radiating to the back. It started right after multiple bee stings. During the first medical assessment, he was conscious with an elevated heart rate. On the skin evaluation, he had erythematous papules on upper and lower limbs concordant with bee stings. He didn't have any past medical history, and based on all of that, at that moment, our differential diagnoses were prismatic angina, pericarditis, or acute coronary syndrome. We proceed to do an ECG, measure troponins, and perform a transthoracic echo. The ECG showed an SCT elevation in the anterior and lateral leads, as you can see on figure 1. The troponins were positive, and the transthoracic echocardiography demonstrated hypokinesia of lateral and septal segments of the left ventricle, and the ejection fraction of the left ventricle was 55%. At that moment, we made the diagnosis of an ST elevation myocardial infarction. Based on all of that, we started on medical therapy with enoxaparin, dual antibiotic therapy, and high-dose statin. Coronary arteriography was performed, which revealed a type 2 dissection of the proximal left anterior descending artery. PCI with balloon dilatation was executed without any complication. The patient was asymptomatic after cardiac catheterization, and the cardiac enzymes decreased to normal levels. The patient was discharged after 4 days with outpatient treatment with aspirin. Prior report of Cuny syndrome treated by honey bee sting in adults included cases in which the acute coronary syndrome was either due to vasospasms or atherosclerotic plaque. Based on our literature review, this is the first case report of an acute coronary syndrome due to spontaneous coronary artery dissection in the presence of multiple bee stings. More studies are needed to clarify the mechanism by which bee venom can lead to acute coronary syndrome. Thank you very much for your interest.